Hey guys, this is Dr. Kadisha, your board certified emergency medicine physician, and my ER and concierge care help people feel better, be safer, and better prepared for emergent medical situations. Okay guys, so I just wanted to jump in here. I'm at work right now. I might have a patient at any time, so I apologize if I have to leave suddenly. Okay, so yeah, I wanted to talk about low back pain today, and I'm trying to broadcast on I'm trying to broadcast on Instagram and Facebook to get ready for my book launch today. So yeah, just bear with me. Okay, so a lot of us have had back pain. Hi Mom, Marlene Reeves is my mom. Thanks for coming in today. So just want to see if some more people come into the room. Okay, hi everybody. Again, this is Dr. Kadisha, your board certified emergency medicine physician. And my ER care and concierge care help people feel better, be safer, and better prepared for emergent medical situations. Okay, let's see if anybody else comes in. Okay, so we'll just get started because I could have a patient come in at any minute, and I'm going to be looking back and forth between here and there. Okay, so back pain is the most common musculoskeletal complaint that drives people to the emergency room, and it affects over 80% of us here in the United States at some point in our lives, and it has cost the U.S. 140 million days of work from people calling out. And thank goodness about 90% of back pain is benign, meaning it's not cancer, it's not life or limb threatening, and about 95% of it is gone in a few months. So yes, it is pretty common to have back pain for a couple of weeks. It could last for, a couple of days to a couple of weeks to a couple of months. Past 3 months, it becomes chronic back pain. And the main categories are lumbosacral pain, like muscle strain, things like that, from like heavy lifting or car accidents, things like that. Radicular pain, otherwise known as sciatica or lumbago, like some people might have called it in the past. And then there are the emergent pathologies. And so we'll just start with the most common. Hi JC Williams, thanks for coming in. Thanks for sharing my posts. You're always so great. I really appreciate it. Okay, so we're talking about low back pain today, and I'm talking about the most common cause of low back pain. Okay, so it's the lumbosacral pain, the muscle strain, and we usually diagnose that. Like I said, it's most of our back pain is that, but we usually diagnose that after we rule out the emergent causes, and I'll just run by those real quick. So the emergent causes are like vascular emergencies, like leaking abdominal aortic aneurysm, or it could be cancer, back pain caused by cancer. That can cause like fractures called pathologic fractures, just fractures due to the cancer. Infection, so you could have back pain and like a nerve deficit with fever, or you could have a fracture like a traumatic fracture. I had a patient today who said that he suffered an L5, meaning the fifth vertebra in his lumbar area, which is the low back, he suffered a L5 fracture from getting run over by a car when he was in the military. And so we were talking about cancer, vascular emergencies, infection, and cord compression, say from a herniated disc or a tumor, things like that. So, okay, so back to the most common cause, and let me just fix my tablet here. Okay, so all right, so back to the most common cause of back pain. So that's the lumbosacral back pain, and who's at risk for that? Those are people who have excess weight, lack of exercise, say, developing arthritis can cause back pain, and we start developing arthritis in our late 20s. And depending on how hard of a life you've had, be it sports or work or bad posture, even smoking, which compromises circulation to your spine, those things can cause arthritis or back pain sooner, or it can cause it to be more severe. Okay, so excess weight, lack of exercise, arthritis, skeletal irregularities like scoliosis. A lot of us have spines that aren't perfectly straight, and we live with that for years, as a youth and everything. But then, as we get older, we might start feeling the pain from that, because the scoliosis can even affect how you walk, depending on how severe it is. And then like bulging or herniated discs can also cause back pain. So what kind of symptoms? And you guys probably already know this, but they are, just to review, and maybe there are some people out there who've never had back pain, but they are muscle ache, shooting, stabbing pains, pain that worsens with bending, lifting, standing too long with walking, and pain that improves with reclining. Okay, so that's lumbosacral pain. Okay, so then people might have pain that leaves the back and travels through the gluteal area, usually on one side, and down the leg, and that's called radicular back pain, or sciatica, or the lumbago that we were talking about. So, and with that, you can have numbness, tingling, weakness along the path of the pain, or you might have numbness or tingling below the path of the pain. So, and sometimes you might just have like a little bit of pain, and then have tingling, in the toe, or somewhere like that. And the risk factors for that, who among us is more likely to get to have sciatica, are people maybe starting in your mid to late 30s. If you're obese, again, the weight puts stress on our back. Occupation, jobs requiring twisting, bending, heavy lifting, driving, and prolonged sitting, which goes along with driving. So people who sit for long periods of time, they're also at risk. And then diabetes. Diabetes is also another risk factor, because the way our body processes sugar, or uses sugar, or fails to use sugar, with diabetes, that can compromise our nerve function. So diabetes, believe it or not, that's a risk factor for sciatica. And a lot of people who come into the ER, they want imaging done. They usually back pain, if it's like, just from bending, or, bending over to tie your shoe and the pain starts, it's like, you don't need an x-ray, but you usually don't need an x-ray, but I know you guys want the x-rays just to, make sure that your back is okay. I know, your back is at the center of you. It's how you're standing and all of that. So you just want to see the x-ray. It's like, forget what the doctor says when we say, hey, x-rays aren't really needed. You still want an x-ray, and that's fine. So and what do the x-rays show? They help to show broken bones. They usually, when you get these x-rays for minor accidents, or you have sudden onset of muscle spasm pain, it might show some what we're going to see is like arthritis. A lot of the times we just see a normal back. Okay, even with car accidents, things like that, a lot of times you see a normal back, like these fender benders, getting rear-ended, those accidents that you can walk away from. Normally we see a normal back, but we might catch some arthritis. But the x-rays don't show the discs, they don't show the spinal cord, they don't show the muscles, tendons, or ligaments. So and then if we do suspect a fracture, usually in the ER we do not have access to MRI, so we get CAT scans, and CAT scans can show more subtle fractures, and they might even show evidence of the infection. Again, one of those emergent causes of back pain that we were talking about, osteomyelitis, and yeah, that's definitely an emergency, an infection of the bone. And MRIs, MRIs show everything. They'll show bruises to the bone, they'll show swelling around the bone, they'll show the muscle, the tendons, the ligaments. They can even show the nerves as they're coming out of the spinal canal, and they'll show the arthritis around the nerve that could be irritating the nerve itself. So it can show everything. Okay, so, and then rarely in the ER we might get blood tests. Like if we suspect an infection, there are blood tests that we can get. So if you have a fever with severe back pain and weakness or numbness somewhere along with that, then we'll get the blood test to see about the presence or severity of an infection. Then, as we get older and we have to worry about osteoporosis, and usually that's like older women who are like petite, things like that, we worry about osteoporosis. And you get your bone scans. You get bone scans for that to look for bone tumors, compression fractures, which are fractures of the vertebral bodies in the spinal cord. So like just fractures that it's just the vertebral body will just be like kind of crushed. And those come from having like low bone density, otherwise known as osteoporosis. Okay, so, and then, if there is cord compression, leg weakness and stuff like that, after the imaging is done, then the nerve studies can be done where the response of the muscle to a nerve is measured, and that can be caused by herniated discs or narrowing of the canal, the spinal canal, where the spinal cord resides, and that's called spinal canal stenosis or spinal stenosis. So treatment for this lumbosacral low back pain or sciatic back pain is typically anti-inflammatory pain medications like Motrin, or aka ibuprofen, naproxen, which is like Aleve, and then there's also another medication that we can prescribe called Toradol. The generic name is Ketorolac, and so those are the anti-inflammatory non-steroidal drugs. And then there are the muscle relaxants like the Norflex, Flexeril, Robaxin, even Valium, which is used for anxiety, that has muscle relaxant properties too. And let's see, narcotics are often used too if those other pain medications don't work, and you can even combine the non-steroidal anti-inflammatories with the narcotics, and sometimes that works even better. Okay, and also antidepressants, the tricyclic antidepressants, those are also helpful. Believe it or not, those can help with low back pain. Even anti-seizure medications can help some. So after that, say we discharge you from the emergency room and we want you to get follow-up. You may end up getting physical therapy. Your primary care doctor may prescribe physical therapy. That's usually after the back pain gets better, and that helps to strengthen your muscles in all the right places and things like that. If that doesn't work, then steroid injections can be used as well, and that can give you either partial or complete relief for a few months, or maybe you don't need to get it again, but usually they'll tell you to expect relief only for about six months or so. So how do you prevent this kind of musculoskeletal low back pain or sciatic back pain? One, exercise regularly. Keeps your back strong. The stronger your back muscles are, the less stress there is on the actual bones. Strengthening the muscle around a joint decreases the stress on the joint. So pay attention to your core muscles, like the muscles in your abdomen and your low back, that are essential for proper posture. And you can ask your doctor to recommend specific activities. Maintain proper posture when you sit. Choose a seat with good low back support, armrests, and a swivel base. Consider placing a pillow or a rolled towel in the small of your back to maintain the normal curvature, and keep your knees and hips level. Lastly, use good body mechanics. If you stand for long periods of time, rest one foot on a stool or a small box, and from time to time, and then when you lift something heavy, let your lower extremities do the work. So they say lift with your legs, and move straight up and down with your legs. Keep your back straight and bend only at the knees, and hold the load close to your body. Avoid lifting and twisting simultaneously. That's a way a lot of people quote unquote throw their back out, or you throw your back into spasm. It's by lifting and twisting at the same time. And if a load is too awkward or too heavy, don't be afraid to ask for help. So I know this is kind of like a dry topic, but so many of you guys come in for back pain, so I just had to address it. So what are those the risk factors for the emergent causes of back pain? Those ones that we were talking about. So those are, say, being age 60 or above, symptoms of cancer like weight loss, immune deficiency like diabetes, IV drug abuse, recent infections, or spinal interventions. It, could be like those steroid injections, or sometimes I've definitely seen people who seen chiropractors and they came in with back pain. Okay, so pain that's not resolved by multiple types of pain medication. The conventional pain medications typically work, so if you're not responding to that, then we've got to keep looking for more serious causes of back pain. History of trauma, of course, like my patient who got run over and sustained that 5th lumbar fracture, and then another person who's at risk for emergent low back pain are people with bowel or bladder incontinence. So if you lose control of your bowel or bladder function, then that could be the sign of compromise of your spinal cord. Erectile dysfunction is another risk factor. Saddle paresthesia, so that part of you that rests on the saddle, that part between your legs, if it becomes numb or tingly, things like that, that's a sign of a significant or emergent back injury. And then worsening weakness in both legs. So that's all I just wanted to go over back pain with you guys really quick, and then make my official announcement for my book launch. My book launch is it's Friday at 12 noon Central Time, and I'll be streaming on Facebook and hopefully Instagram, and technical difficulties notwithstanding, but I should be streaming on both. And my book is called Help Us Help You. This book is 20 years in the making, and it is a culmination of the questions, the complaints, the confusion, the misunderstanding, the everything that people have come to me with. As soon as they find out I'm an emergency medicine doctor, they have all these questions, and they'll say, "Oh, this happened to me in the ER. Why did this happen? The nurse asked me a bunch of questions, and the doctor came and asked me the same questions. My information's in the system, but they asked me the questions all over again." It's that and more. And my book is, it addresses things that you can do to be better prepared before you even need an emergency visit. It talks about things that you can do once you realize that you need to go to the ER, and then what to expect on arrival, and like your treatments, the results, and a bit about your billing at the end. So it's called Help Us Help You in the Emergency Room, and that simply means you help your doctors and nurses and your ER team help you in the emergency department. It's meant to replace the misunderstandings, confusion, and anger with understanding and tips that help you get the most out of your emergency room visit, hopefully in the quickest way possible. So on that note, I'm Dr. Kadisha. I'm your board certified emergency medicine physician. Please follow me on Instagram, Facebook, and Twitter at DrKadishamd. That's on Instagram, Twitter, and Facebook. And please join me for my book launch at 12 noon Central Time. So that's 1 p.m. Eastern Time on Facebook at Dr. Kadisha MD, and on Instagram at Dr. Kadisha MD. I hope this information helps you out and helps you maybe avoid back injury and deal with it better. And I'll talk to you next time. Bye.